Imagine you're sitting at your desk, finishing a report, when you suddenly realize you can't feel your thumb. You shake your hand, hoping the blood starts flowing again, but the tingling remains. It feels like a swarm of tiny ants crawling under your skin, or a heavy coldness that makes your fingers feel like lead. These sensations are often dismissed as a minor inconvenience, but they are significant warning signs. As a medical expert, I have seen many patients who waited too long to address these symptoms, only to find the damage had become much harder to treat. Numbness and tingling are the primary ways your body tells you that a nerve is being irritated or compressed. They are like the smoke that alerts you to a fire. If we want to put the fire out, we have to find exactly where it started. To do that, we analyze the specific distribution of these feelings. Nerves follow predictable paths, almost like a map of city streets. By identifying which street is experiencing the jam, we can pinpoint the source of the irritation. The median nerve is a frequent source of these symptoms, leading us to carpal tunnel syndrome. The carpal tunnel is a narrow, rigid passage of bone and ligament at the base of the hand. The median nerve passes through this tunnel to provide sensation to several fingers. If you feel tingling in your thumb, your index finger, your middle finger, and the thumb side half of your ring finger, the median nerve is likely involved. You might even feel it in the palm of your hand. Many people find these symptoms are worst in the early morning. You might wake up and feel the need to shake your hand vigorously to wake it up. This is called the flick sign. These symptoms also flare up during repetitive tasks, like long hours spent typing or holding a smartphone. The pressure inside that small tunnel increases, squeezing the nerve and causing that familiar buzzing discomfort that refuses to go away. However, looking only at the wrist can be a major mistake. This is where we encounter the antagonist of our story, the incomplete diagnosis. Your nerves are long wires that originate in your neck, specifically in the cervical spine. The nerve roots labeled C5, C6, and C7 are the foundations for the nerves that travel down to your fingertips. It is entirely possible for a problem in your neck to mimic a problem in your hand. A pinched nerve at the C6 or C7 level can cause numbness in the exact same distribution as carpal tunnel syndrome. If a patient has a bulging disc or bone spurs in their neck, those structures can press on the nerve root right where it exits the spine. This radiates the sensation down the arm, leading many to believe they have a wrist problem when the actual issue is located higher up. Differentiating between these two locations is the critical step in a successful recovery. If we treat the hand when the neck is the source, the patient will never find relief. To determine if the problem is coming from your neck, we use a specific diagnostic maneuver in the clinic. We ask the patient to tilt their head back and rotate it toward the side where the hand feels numb. This action reduces the space where the nerves exit the cervical spine. If moving your head in this way causes that familiar tingling to shoot down into your hand or makes the numbness worse, it is a strong indicator that the irritation is happening in the neck. We are essentially testing the source of the power line. If the signal flickers when we move the main switch, we know the problem isn't just at the light bulb in your hand. Understanding this connection between the spine and the fingers is how we begin to solve the puzzle of nerve pain. Before we continue, subscribe to the channel and tell us in the comments where you're watching from. While we have been talking about the thumb side of the hand, there's another common area of trouble. This involves the ulnar nerve. If you have ever felt your pinky finger and the outside half of your ring finger go numb, the ulnar nerve is likely the cause. Most people know this nerve because of the funny bone. When you hit your elbow and a sharp shock travels down your arm, that is the ulnar nerve being bumped against the bone. It is a very sensitive area because the nerve sits right on top of the bone with very little protection to keep it safe from bumps. There are two main places where this nerve gets squeezed. The first is at the elbow in a spot called the cubital tunnel. If you spend a lot of time leaning on your elbows at a desk or keeping them bent tightly while you sleep, you are putting a lot of pressure on this nerve. This can cause the nerve to become inflamed and painful. The second spot is at the wrist, in a small space known as Guyon's canal. This often happens to people who ride bicycles for long distances. As they lean forward, they put all their weight on the heels of their hands, right where the nerve passes through. Just like with the other nerves we discussed, we must look at the spine to find the true origin of the problem. The ulnar nerve starts from the C8 and T1 levels of your neck and upper back. If the source of the problem is in the spine, you might feel an ache or a tingling sensation that starts in your shoulder and goes all the way down to your pinky. The antagonist of our story, the incomplete diagnosis, often happens here. A doctor might only look at the elbow because that is where the patient feels the most discomfort. They might even suggest a surgery to move the nerve at the elbow. However, if the real blockage is at the C8 level in the neck, the surgery will not work. The patient will wake up and still have the same numbness they had before. Next, we look at the radial nerve, which handles the feeling on the back of your hand. If you feel numbness on the skin behind your thumb and the top of your hand, the radial nerve is involved. One common issue is radial tunnel syndrome. This happens when the nerve gets squeezed by the muscles in your forearm near the elbow. This can feel very similar to a condition called tennis elbow. Because the pain is in the same spot, many people treat it as a muscle strain when it is actually a nerve problem. Once again, we must trace it back to the neck. The radial nerve path comes from the C5 through C8 nerve roots. A pinch in the neck can feel like a simple muscle strain in the arm. This leads us to a very important concept called the double crush syndrome. To understand this, imagine your nerve is like a long river flowing from your neck all the way down to your hand. For the water to flow perfectly, the river needs to be clear of any debris. Now imagine there is a small pile of rocks in the river at the neck. It is not enough to stop the water completely, but it slows the flow down. By itself, you might not even notice a problem. But then, further down the river at the wrist, there is another small pile of rocks. On its own, this second pile is also minor. However, because the flow was already slow from the first pile at the neck, the second blockage at the wrist stops the water. This is how nerves work. If you have a mild irritation in your neck, the whole nerve becomes more sensitive to pressure. A tiny amount of pressure at the wrist suddenly causes major numbness because the nerve was already struggling. This is why many people who have hand surgery do not get better. The rocks at the bottom were moved, but the rocks at the top are still blocking the flow of the river. Let's look at a real-life example of how this double crush concept works in a clinical setting. I once worked with a male patient who had been dealing with classic symptoms of carpal tunnel syndrome for a long time. He had numbness and a burning feeling in his thumb and index finger. His previous doctor did a standard exam and a quick test that showed slow signals at the wrist. Based on that small amount of information, the patient was told he needed surgery. He went through with the operation and followed every instruction his doctors gave him, but the relief never came. Weeks went by, and his hand felt exactly the same as it did before the operation. He was frustrated and losing hope. This is a perfect example of where the antagonist, the incomplete diagnosis, caused a lot of unnecessary pain and stress. When I finally met this man, we decided to start over from the beginning. We didn't just look at his hand, we looked at his neck. We performed more detailed tests, including something called an EMG. This test isn't just about looking at one spot. It traces the entire length of the nerve. It's like a repairman checking a long electrical wire to see exactly where the power is cutting out. What we found explained everything perfectly. While there was a tiny bit of pressure at his wrist, the real problem was much higher up in his body. He had a massive disc herniation at the C7 level in his neck. This disc was pressing hard on the nerve root where it leaves the spine. Because of the double crush effect, his wrist felt the worst, but the neck was the real source of the trouble. The surgery on his hand had cleared a small blockage at the end of the line, but the huge blockage at the source in his neck was still there. Once we identified the disc herniation at C7, the treatment plan changed completely. We didn't need another surgery on his hand, and we didn't even need surgery on his neck. Instead, he received a targeted injection in his neck to reduce the swelling around the nerve root. Within a few days, the numbness that had bothered him for years started to go away. The burning feeling disappeared. He finally had his life back because we finally found the right diagnosis by looking at the whole picture instead of just one spot. This story shows why complete testing is so vital. Doctors often use an EMG along with a nerve conduction study. These tests measure how fast electrical signals move through your nerves and how your muscles react to those signals. A common mistake is to stop testing as soon as one small problem is found. If the test shows a slow signal at the wrist, many doctors stop right there and call it carpal tunnel. But a medical expert knows to keep looking. They must check the elbow, the shoulder, and most importantly, the neck. You have to trace the entire nerve chain from the spine all the way down to the tips of the fingers. If you only look at the part that hurts, you might miss the part that is actually causing the pain. The main rule of diagnosis is simple. If you don't look for it, you can't find it. This is why you must be your own advocate when you go to the doctor. If a doctor suggests surgery based only on a quick talk or one small test, ask them about the rest of the nerve. Ask if they have checked your neck. A full nerve evaluation should be done before anyone suggests surgery. Surgery changes your body forever, and you want to be sure it is being done in the right spot for the right reason. As we finish, remember that your body is all connected. A tingle in your pinky or a numb thumb is just a signal. It is your body telling you that something is wrong somewhere along the line. Don't settle for a quick fix or a partial answer. Find a doctor who will look at the big picture and trace the path of the nerve from beginning to end. If you found this helpful, please share it with others who might be dealing with these symptoms. By sharing this knowledge, we can help people avoid the wrong treatments and find the real source of their pain. Stay healthy and always look for the root cause.